Hey, it's Dr. Schmidt. I want to go over one article and then also recommendations from a pulmonologist in critical care. So here's this article. The title is Israeli Professor Shows Virus Follows Fixed Pattern. So his name is Professor Yitzhak Ben Israel. And what he did was he also worked for Teva Pharmaceuticals, but he plotted the rates of new coronavirus infections of the US, UK, Sweden, Italy, Israel, Switzerland, France, Germany, and Spain. And irrespective of whether the country quarantined like Israel or went about business as usual like Sweden, coronavirus peaked and subsided in the exact same way. In the exact same way. His graphs show that all countries experienced seemingly identical coronavirus infection patterns, with the number of infected peaking in the 6th week and rapidly subsiding by the 8th week. So I'm going to scroll down a couple paragraphs. And he says, but what about Italy and their staggering 12% mortality rate? And here's what he says. The health system in Italy has its own problems. It has nothing to do with coronavirus. In 2017, it also collapsed because of the flu. Indeed, Italy's exceptionally high coronavirus mortality rate is eerily reminiscent of their unusually high flu mortality rates. Supportive of this theory, Germany has low flu infection and mortality rates and similarly low coronavirus rates. So he says, I think it's mass hysteria. I have no other way to describe it. And then down at the bottom, he's talking about various politicians making decisions based on wild computer models. And the prediction was 2.2 million deaths in the United States and 500,000 deaths in the UK. But the model was developed by Professor Neil Ferguson, who had a history of wildly overestimating death rates through his prediction models. Professor Ferguson was not known for his reliability, and his 2001 disease model was criticized as not fit for purpose after it predicted that up to 150,000 people could die in the UK from mad cow disease, but only 177 people died so far. Ferguson's UK coronavirus deaths prediction is now down to 20,000 people, 4% of the original prediction. So it was wildly overblown, and the source of that was this guy, Professor Ferguson. And every year there's a coronavirus flu problem, just like there's influenza A, influenza B. There was a study done at University of Michigan just released a few days ago showing that the coronavirus is part of the flu season every single year for the last 8 years that they've been studying this. The next thing I want to go over is the Eastern Virginia Medical School, and this is from a medical doctor, critical care pulmonologist, chief of pulmonary and critical care medicine. And this is what it says. Urgent. Please circulate as widely as possible. It is crucial that every pulmonologist, every critical care doctor and nurse, every hospital administrator, every public health official receive this information immediately. And this is updated on a regular basis. It was last updated 2 days ago. I'm going over this because he's got some really good information. He's using vitamins and minerals in his recommendations. But this is what it says. This is our recommended approach to COVID-19 based on the best and most recent available literature, including the Shanghai Management Guideline for COVID and recent information from Italy. We should not reinvent the wheel, but learn from the experience of others around the world. It is important to recognize that COVID-19 does not cause typical ARDS, acute respiratory distress syndrome. This disease must be treated differently, and it is likely that mechanical ventilation may be exacerbating the situation by causing ventilator-induced lung injury. That is, the ventilator may cause the disease we think we are treating. Patients suffer from oxygenation failure and not lung failure. Furthermore, this is predominantly an immune and clotting disorder and not a lung disease. If what you're doing ain't working, change what you are doing. We have zero success for patients who were intubated. Our thinking is changing to postpone intubation to as long as possible to prevent mechanical injury from the ventilator. These patients tolerate arterial hypoxia surprisingly well. Natural course seems to be the best. If they're saying that what we've been doing doesn't work very well, we want to avoid intubation, and here's the series of symptoms that can occur and signs and then potential treatments. And so scrolling down, prophylaxis right here. So what is he recommending to prevent this from ever occurring in the first place? This is while there is very limited data and none specific for COVID-19, the following cocktail may have a role in the prevention mitigation of COVID-19 disease. While there is no high-level evidence that this cocktail is effective, it is cheap, safe, and widely available. Vitamin C, 500 milligrams twice a day. Quercetin, 500 milligrams twice a day. Zinc, 75 to 100 milligrams per day. And zinc lozenges are preferred. You can reduce the dose after 2 months. Melatonin, begin with a small dose and increase it as tolerated. And then vitamin D3, 1,000 to 4,000 units per day. I give that protocol a B plus. That's pretty good. I would change the vitamin C to liposomal, and I would increase it to 1,000 milligrams once or twice a day. The quercetin is really good. The zinc is a good recommendation. The melatonin, it shows that it helps with the immune system, and it's got a lot of properties that are even anti-tumor, and it could be antiviral. But I've not recommended melatonin. And then the vitamin D3, I would increase that tremendously. Most people who live in the United States are underneath a roof most of the day and night, and they don't get sun. So I would say, if you're concerned, I would make that vitamin D3 10,000 units per day, plus K2. Always take vitamin K2 and D3. We have a supplement called vitamin D3 K2. And the K2 dosage is usually correct when it comes with a D3 supplement. Because the nutritional researchers know what they're doing when they put D3 and K2 together. So, and then you could do that 10,000 units a day for 2 months, and it's completely fine. And it's really, really, really hard to overdose on vitamin D3. Okay, for people who are mildly symptomatic, they're at home, I would increase that vitamin C from 1,000 milligrams of liposomal to up 5,000, easily 5,000, maybe even 10,000. And the quercetin sounds good to me, 250 to 500 milligrams twice a day. The zinc, you can increase that. Melatonin, he increases it to 6 to 12 milligrams at night. And the vitamin D3, increase that tremendously higher than what he's got right there. Then he throws in the hydroxychloroquine optional. So I don't study drugs. That's not my license. I don't talk about recommending drugs. People ask me, should I take this drug? I never answer that question. But I would be throwing in, that's where these herbs come in. So the St. John's wort, for sure, berberine, eleuthero. And you can see my previous videos where I talk about all these other herbs and nutrients that are available. The herbal field is just not well accepted at all, even with holistic medical doctors. They talk about vitamin A, vitamin C, vitamin D, and minerals like zinc. And then the ozone is a good option. Nebulizing iodine, that's all good. We're dealing with minerals, and etc. But the herbs, they're so dynamic, and they have so many other cofactors that help the immune system and help the body in so many other ways. And I think I would surmise that their power is even equal to or greater than the concoction of pharmacological dosing of vitamins A, C, D, and zinc. So the herbs they're just so much more creative. They have so much more personality. Now, keep in mind that the number one predictor right now for the comorbidity is weight. So people who are obese are at a greater chance of succumbing to this virus, even greater than people with heart disease, diabetes, high blood pressure. So it always comes back down to the metabolic situation. Like, how healthy are you in your body? Only 12% of Americans are metabolically healthy, meaning that they're on a low insulin diet. They're eating meat and vegetables, and they're avoiding all the breads and all the sugars and all the pop and all the junk food. And their metabolism is in good shape. That's only 12% of the population. So 88% of Americans have a greater risk of getting this problem. So the most important thing is always getting back to having a healthy body. That's always the situation. You want to work on getting your health up. So if you need our help, you can call the office. I'll put that at the end of this video and below for more information. And I'll put links below too so you can do your own research. And don't forget to get my free ebook where I talk about the foundations of improving your health. And you can download that without even giving up your email address. And I turn that ebook into a video course also. And I give more information in the video course. They're both super valuable. I spent 8 months putting these together. They're now available to you below.